Good day, I am Jessa May Corpus, nurse student from Medical College of Northern Philippines, and today I will be assessing the eye, ears, nose, mouth, and throat of the patient. So for the assessment, we will need alcohol for sanitation, sterile gloves for protection, a pen light, a Snellen chart, a cotton applicator, a ruler, a ball pen, and a paper for documentation and a ghost swabs. So for the procedure, first I will identify the patient, explain the procedure, and introduce myself. So good morning, sir. I am Jessa May Corpus, your nurse student for today. So may I ask what is your name, sir?
I'm January Priola,
And your birthday, please?
September 15, 2001.
How old are you, sir?
I'm 20.
Okay. So for today, sir, I am going to assess your eyes, ears, nose, mouth, and throat to know if there are any problems. Is that okay with you?
It's okay.
Okay. So, sir, do you have any problem with your eyes?
Nothing.
Did you wear eyeglasses or eye contacts?
Of course not.
Do you have any problem with distant vision or near vision?
Nothing.
Okay. Now I am going to perform hand hygiene. And wear gloves. And of course, close curtains or doors for my patient privacy. So now I will going to start by inspecting my patient eyebrows, eyelids, and eyelashes. So sir, first I'm going to inspect your eyebrows. Is that okay with you?
It's okay.
Okay, now may I see your eyebrows? Okay, your eyebrows are symmetrical and in line with each other and evenly distributed. And for the symmetry of your eyelashes are symmetrical as well. We will proceed inspecting your eyelids for position and symmetry. Okay. Your eyelids are well positioned on your face. So to examine your lacrimal glands, I will lightly slide the pad of my index finger against to your upper orbital rim. So here. Okay, sir, do you feel any pain or tenderness?
I don't feel at all. I don't feel nothing.
Okay, now I'm going to palpate your nasolacrimal duct to check for obstruction. So first I will going to check on your left eye. So here. Okay. On the right eye. Okay. Okay, there are no obstruction from the left and the right eye and it is normal. Now I'm going to examine your bulbar and palpebral conjunctiva. First that I am going to examine is your bulbar conjunctiva. So sir, could you please look up? Okay, sir, look up. Okay, sir, as I look to your bulbar conjunctiva, it is pinkish in color, no swelling, and no foreign objects. Now I will start assessing your palpebral conjunctiva. So using this cotton swab and cotton applicator. So sir, allow me to touch your eyelids. Maybe this is uncomfortable. So sir, can you please look down? Now I'm going to place the cotton tip applicator about 1 centimeter above the lid margin and push gently downward. Okay, sir. Okay. I can see that there is no swelling, infection, and no presence of foreign objects. Now, sir, look up and breathe. Okay. Now I will proceed on the right side of your eye. Right eye. Okay. Okay, there are no swelling, infection, and presence of foreign objects. Next, I will be inspecting your sclera. Okay, sir, allow me to touch your face.
Okay.
Okay. Your sclera is white and dull yellowish discoloration. Next, I will inspecting your cornea using the pen light. Okay. Okay, your cornea has no irregularities. It is clear and there is a positive corneal reflex. Next, I will inspecting your anterior chamber and iris. Okay, sir, your anterior chamber is transparent and your iris is color brown, which is normal. Okay, now I'm going to inspect the size and shape of your pupils. So, for your pupils, it is equally round and it is 5 millimeter and are equally sized. Now I'm going to test the pupillary reaction to light. I am going to turn off the light, but since it is daytime, I can't turn off the light. So I will ask you to focus on the distant object and I will shine obliquely into your eye and observe the pupillary constriction. Okay?
It's
Okay, look straight and any object behind me. Okay, on your left eye. And to the other to the right eye. Okay. Okay, the right eye constricted. Shine a light here on the left eye. Well, for the left eye, constricted as obliquely shine a light in the right eye as well. So both eyes have a pupillary response, which is constriction, and both are normal. Now I'm going to test pupillary accommodation. So, sir, could you please stare at any objects behind me? So, I will use pen light to check pupillary accommodation. Now, fix your gaze. Fix your gaze here on my index finger. Okay, your pupils dilate when looking at distant objects and constrict when looking at near object. And for the findings of Perla, pupils equally round, reactive to light, and accommodation. Now I am going to test the visual acuity using the Snellen chart. So, sir, can you please stand up 20 feet apart from the Snellen chart? We'll use the ruler to point the letter randomly and you can tell to me what is the letter. Okay? So, sir, your right hand cover with your right eye. Okay. Now I'm going to point. Okay, start.
E F F L E.
Okay, now with your left hand, cover with your left eye. Okay.
D Z T P E C.
Okay, that's good, sir. So, sir, can you please go back here? Now we are going to test the peripheral vision. So, okay, sir, cover your left eye and I will do the same. And then I will use the pen light. I will move it horizontally and upward and downward. So, if you already see it, you can say it by now. Okay? Okay, let's start.
Now. 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 Now.
Okay, that's good. We are done assessing your eyes. So now let's proceed inspecting your ears. So now we will proceed assessing the ear of the patient. So before anything else, may I ask some questions, sir?
It's okay.
Okay, so sir, do you have any ear problems with your ear?
I don't think so.
Any hearing loss?
None.
Do you have family history of ear problems?
I don't know.
Are you doing an activity that may cause ear problems?
I don't think so.
How often did you clean your ears?
Twice a week.
Okay, so now I will proceed checking your ears. So for this procedure, I will go into inspecting and palpating and looking your ear. Is that okay with you?
It's okay.
So this procedure, it will help you to know if you have any ear problem. So first, I will inspect the auricles of your ears for parallelism, size, position, appearance, and skin color. Okay. Okay, so it is parallel. The earlobes are bit-shaped, symmetrical. Next for the size. the size of it is equal in each side, bilateral equal on the left and the right side. Okay, now for the position of it, now looking at the position of your ear on your head is normal since it aligns each corner of the eye. Next, I am going to check for the appearance. Okay, your earlobes are free in each side, and there are no lumps, no bumps here in your ears, and the color of your ears and the color of your skin is consistent with your facial color, and there are no evidences of erythema as well. So now I am going to start palpating for ears. Okay, sir, can I touch your ears?
It's okay.
Okay. So for the right ear, I'm checking for any firmness of the cartilage and tenderness. So sir, does it hurt?
Nothing. I mean, it doesn't hurt.
So I'm going to palpate the pinna or the auricles. Now I am going to palpate the mastoid process at the back. Sir, does it hurt?
I don't feel anything at all.
Okay, for the left ear, I am going to palpating for the firmness of cartilage and tenderness. And for the mastoid process of the back. So sir, does it hurt?
I don't feel nothing at all. I don't feel at all.
Okay, so that is tenderness since he doesn't feel any pain and tenderness in the ear, which is normal. And for the mastoid process at the back of the ear, so overall, there is no tenderness in both the left and the right ear, which is normal. Next, I am going to inspect the auditory meatus or the ear canal for color and presence of cerumen, discharges, and foreign bodies. So, since my patient is adult, I will going to pull her pinna upward and backward. So, I will start for the left ear using this pen light. Okay, sir, I'm going to pull your pinna upward and backward. Is that okay with you?
It's okay.
Okay. And to the right side, sir, I am going to pull your pinna upward and backward. Okay. So, his ear canal is skin colored, which is the normal skin, and there is no presence of cerumen, no discharges, and no foreign bodies, and that is normal. So, now I'm going to start with the hearing test. First is the whisper test. So, sir, okay, sir, do you know which ear has the best hearing?
The right.
Okay, let's start with your right ear. Okay, sir, can you please occlude your ear and grab your tragus area in the ocular motion like that?
Okay.
Okay, then sir, I will going to whisper a two-syllable word, and then you can tell to me what is it. Okay?
It's okay.
Okay. Okay.
Black sheep.
Okay, sir. Now I'm going to on the other side, on the left ear. We will do the same, okay?
Yeah.
Okay, I'm going to whisper a two-syllable word. Okay, one, two, three, go.
Blue sheep.
Okay, that's it, sir. So both the left and the right ear is normal. So sir, so since there is no tuning fork, I will skip the procedure. So now we will proceed for the assessment of nose, mouth, and throat of the patient. So first that I am going to do is the nose assessment and the mouth, and followed by the mouth and throat assessment. Okay, sir, we're going to assess your nose, and any unusual findings will be followed of the focus. Assess.
Okay.
So from time to time, I might ask you some simple commands, and you should follow them. Okay?
Okay.
Okay, sir, now I'm gonna ask you a couple of questions for the nose, mouth, and throat, okay?
Okay.
Any problems with your nose?
None.
Any problems with your mouth and throat like tonsillitis?
None.
Any changes in the color of your gums?
None.
Any frequent cold sinus infections?
None.
Do you ever had those problems?
None.
Mouth and throat problems?
None.
Does your family had a nose, mouth, and throat cancer?
No.
How often do you brush your teeth
2 to 3
or
times a
clean
day.
your mouth?
2 to 3 times a day.
Any eating habits like do you eat more
I
sweets,
don't-
more candies, or anything like sweet?
I don't think so.
Okay, we're done, sir. So let's proceed to your nose infection and palpation. Okay.
Okay.
So now I'm going to start inspecting your nose. Okay. Now I'm gonna hyperextend the patient head upward and shine a light to see if there are using the ulnar aspects of my hand. Okay. Now and using this pen light. I will gonna use this pen light. Okay. Now I'm going to push the tip of your nose upward and shine a light to see if there are any exits, if there are any swelling change in color. Okay, I'm going to start. Okay, so the nasal mucosa and the turbinates is dark, pink in color. It is moist and it is free from any exudates or discharges, which is normal. And the septum is midline, okay, and well intact. There are no swelling, there is no exudates, and there are no change in color in her internal layer or internal nose, which is normal. Now, I'm gonna start palpating the paranasal sinuses of the client. So, I'm gonna check the maxillary and the frontal sinuses. So, for the maxillary, I'm gonna press using my thumbs the both cheeks and as if there are any tenderness. Okay, so sir, I'm going to place my thumb on your both cheeks. Okay, sir, do you feel any pain or tenderness?
No. Okay.
Okay. How about in your frontal sinuses? I'm going to place my thumb in your below your eyebrows. Okay. Tell me if you feel any pain. Okay.
I don't feel anything at all.
Okay. So there is no tenderness in both maxillary and frontal sinuses, which is normal. Now let's move on the inspection of the mouth. Okay, sir. As I look in your mouth, it is symmetrical and your lips are pink. Sir, can I touch your lips?
It's okay.
Okay. Okay. Your lips are smooth to touch. There are no lesions and there is no edema and there's no bleeding as well, so it's normal. Now I'm going to check the view mucosa. Sir, can you please open your mouth for me? Okay. Okay, look. So I'm checking the side of her mouth. Okay. Or the mucosa and it's pink. It is shiny and there is no lesions, there is swelling in this area and no discharges as well. Okay, now let's move on to inspecting your teeth. So, sir, could you please smile for me? Okay, my patient is wearing braces. Okay, so his teeth are complete. There are no dental caries, there are no dental fillings, her teeth are well aligned, and there are no malocclusions or the overlapping of teeth. This were. And as I assess, the patient has a fresh breath without any bad odor, which is normal. Okay, so overall, it is normal, sir.
Okay.
So now I'm going to assess gums. You're a gum, sir. Okay.
Okay.
So, sir, can you please open your mouth for me? Okay. I can see your gums. Okay. Your gums are pink. It's firm without any evidences. Gingival and hyperplasia. It is not overgrowing and any redness gums. Maybe it is a sign of gingivitis. So, for Mr. John Merwin, her gums are normal. And lastly, for the tongue, I'm going to check for the dorsal and the ventral tongue. Okay, sir, could you please show your tongue? Okay, I'm going to check your tongue. Okay, so the tongue is in the midline. It is the center and it is pink. And it's rough because of the presence of papillae. Okay, sir, could you move up your tongue for me? Okay, I see that the ventral tongue is shiny and pink and a lot of veins, which is normal. Okay, there are no evidences of mouth cancers because usually mouth cancers can be seen here in the ventral area. As I inspect, there are no swelling, lesions or any discharges are also absent. Okay, now I'm going to start palpating your tongue, sir. Okay, now using this hand gloves and this good swabs, I'm going to palpate your tongue. Is that okay with you?
It's okay.
Okay, now I will start. Show me your tongue, sir. Okay. I will palpate in this side. Does it hurt, sir? Okay, on the other side. Does it hurt, sir? Do you feel any pain? Okay. So his tongue has no tenderness upon palpating, and there is no masses I palpate on the tongue, which is normal. Okay, now let's move on inspection of the throat. I'm gonna check for the three things, which is the uvula, gallbladder reflex, and the tonsillitis.
Okay.
For the uvula, I'm going to check using the Creel number 7 test by asking the saying of the patient. Okay, sir. Open your mouth. And can you please say ah? Again. Okay. So as the patient says that is elevation of the soft palate and movement of the uvula, which is normal. And next, since I don't have any available tongue depressor for the assessment for the checking of gag reflex and the tonsillitis, I will skip this procedure. Okay. We will remove the gloves and perform hand hygiene.